Welcome everyone. Welcome to the first panel discussion in this series on scalable computing for pandemic preparedness and resilience. Let me start by thanking our sponsors, NSF, who have been very kind to support us in this project. And in fact, I would say that this whole effort is really a partnership between us and the NSF. We're working together to prepare for the next pandemic, and we all invite you to join this effort. We put together a very interesting program, and for that I would like to thank Lakshmi, John, and Arvind, along with Venkat, who were the program committee members and really were instrumental in putting together an outstanding program. And of course, Erin Raymond and Golda Barrow have really done an outstanding job in bringing all this to fruition, in my opinion. Finally, let me briefly thank Lee, Xiong, Anil Wulikant, and Simon Levin, who are the co-PIs on this project. And I'm sure they will join us as well as the meeting proceeds. So we had some great discussions leading into this meeting. Before I hand over the floor to Alex, let me just let everyone know that the plan is for us to have the 3 talks and then take on the questions. But if you have questions, do post them in the chat, and then we will allow folks to ask the questions in some order. And I'll moderate the session. We have about 1.5 hours for the first session. There's a second session in the afternoon, and then 2 more sessions tomorrow as well that my colleagues will run. And the intent is to collect all the information and the discussion we have here and make a report that we send back to NSF. NSF is very keen to hear from the community. You know, NSF works bottom up, and they have requested us to collect input from the community so that they can plan on new programs that can allow us all to do research in this important area. So with that, let's start the first panel. The first panel is on effective epidemiology for decision makers, and I will serve as a moderator. As I said, we are very lucky to have 3 outstanding speakers today. All 3 of them have done work during this particular pandemic. I'm very lucky to have them on board. So first off is Professor Alex Vespignani. Alex is a dear friend and a longtime colleague of ours. He's a Sternberg Family Distinguished University Professor at Northeastern University, and he leads the MOBS lab there. He's also director of the Network Science Institute. Alex has made foundational contributions to network epidemiology, and along with his group, has played a really important role in the ongoing COVID response efforts. His research is focused on modeling diffusion phenomena in complex systems, including data-driven modeling of infectious diseases. So Alex, over to you, about 12 minutes or so, and then we'll move to the next speaker. Thank you very, very much for attending.
Thank you very much, Madhav, for the great introduction. And it's really a great pleasure to be among friends and colleagues, as you say, for many years at this point, and many epidemics that we went through together. And let me share my screen and try to see if we can work the slides. I think we are fine. So I take the title of this panel to provide a few of my sense on effective decision making with epi modeling. First, a little bit about our team. We have been working on multi-scale modeling and with a focus both on small scale and large scale spreading of infectious diseases since I think 2000, early 2000, and then we have been part of the MIDAS program, collaborating with a large number of colleagues there. And during the COVID-19, we have been working both in the early stage of the pandemic for international introduction, etc., and then more into the forecasting and scenario analysis along the various stages of the pandemic Let me say what for me is decision making. Well, for me, the decision making is provide actionable intelligence, actionable modeling with data, and new data, big or small, old data. You know, everything is important. But you know, my focus is in a sense, and for me, the focus is to get from something that is, you know, this time series of cases and deaths or hospitalization into something that is much closer to what we would define the modern weather forecasting, in which we have, you know, very good control on our uncertainty on initial conditions, prediction limits, etc. I think, again, I don't want to put any specific tag on an approach or a modeling approach. It might be mechanistic, and this is what I will talk more during this presentation to discuss a few points. But you know, at this point we have a lot of contribution from machine learning, artificial intelligence that is crucial. The problem is that we want a weather interpretability. I think the decision making and the actionable results implies interpretability and understanding of what is going on, and not just, you know, a few numbers of what will happen next week or a few weeks from now. The other point that I want to stress initially is that, okay, we have a lot of focus on forecast, and there have been a lot of discussions about forecasts especially in the past several months in the media. Scenario analysis with all the the confusion about what is a scenario, what is a forecast, but I'm pretty sure we will have time to get into that. But actually, modeling and actionable modeling, decision making is much more than just forecast. There is situational awareness, there is intervention planning, there are epidemiological explanation, all the counterfactual that we can investigate, and so on and so forth. So it's really important to say that modeling acts in these different in many different ways, and not just in the forecasting area. And let me say also that there are very different stages that we need to contemplate when we enter a situation like that we have been through in the last 2 years. So we have an early stage in which we have limited data. Actually, we almost have zero knowledge on the emergent disease and the pathogen. There is a constantly changing landscape and a huge amount of assumptions. So this, bring us is mapped into computational challenges. That means, first of all, that we are in a wartime production mode. That means, you know, we have to change basically every day, perhaps, what is the modeling approach, our framework, the data, and in addition, we have to work on basically in an unknown parameter space that we have to explore. And that is what is the challenge for the computational modeling, because we need to really work a lot on exploring what could be the phase space of our modeling approaches. There is a second stage in which we know more about the disease, and we enter an international perspective. Is case introduction, is the internationalization of the various outbreaks, the definition or not of when we call it a pandemic or not, the cryptic spreading of a disease. And that corresponds generally, again, to challenges that are related to data integration that must include data from all over the world, the fact that we are working with models which are very large scale, and so on and so forth. And then we get into a more, settled down situation in which we are working with data pipelines, ground truth, more regular output for forecast scenarios, and data analysis that are more on a week-by-week basis. In that case, what we have to emphasize is the reliability of the modeling approach, the dependability, the frequency of the effort that we can produce, and the fact that we generally have a longitudinal time challenge with the models. So while perhaps we know a bit better the parameters of a specific model, we have to keep into account the entire history of the epidemic for getting predictions, forecasts, scenario projections, and that is another numerical challenge. these are all challenges that are mapped generally, at least in our case, in high performance computing and high performance data analysis. And so in the building of these computing pipelines. Just give me in a couple of minutes a few examples of our work that I can map at the different stages of the pandemic. The first one was in January 2020, situational awareness. So there are a cluster of a few tens of cases in Wuhan, and we need to understand what is the actual magnitude of the epidemic there. Well, you do that through generally the analysis of cases detected internationally. You do basically a reverse calculation from traveling flows and the population and the social demographic data that you have from the epicenter of the outbreak. And you, through probabilistic methods, can say, well, what is the probability if I have observed 2 cases in Thailand and 1 in Japan, that my epidemic is 20 cases, 100 cases, 1,000 cases. Well, you repeat these calculations with new cases, with all the various uncertainty, and you get posterior distribution for what is the possible magnitude of the epidemic. And you get immediately, at that time, we were getting thousands of cases. This is something where you really need to have the machinery in place. You need to have the data. You need to have everything ready. The same is when you start to have a mechanistic modeling approach and you are trying to understand, for instance, how cases importation changes, how travel restriction affects the introduction of cases across the world. This is again is where you need to have those larger scale efforts because you have to consider data that are coming from all over the world, and you have to simulate actually the ongoing epidemic in worldwide. This is also, for instance, to provide analysis that I think are important during the early stage of an epidemic, when you don't have or you have very limited testing to understand what is the cryptic transmission of a disease. When you start to have a lot of cases that actually you are not aware, or at least you cannot officially confirm because of lack of testing, of test facilities and so on and so forth. And this is something, again, that models allows you to do. And I think is very important. It would be great to have an infrastructure that can spring right away, and not just with a few groups, but in a sense of a generalized effort computationally to help at this early stage of intervention. This is, for instance, is the calculation that we were doing at that time in February about what was the origin of introductions in the United States and Europe. And as you see, there was a very rapidly changing landscape. China was just originally for the first few cases, but then Asia and Europe and other places were extremely important. There were not the outbreaks also in those places, and then domestic transmission was extremely important already in February to see the epidemics in those continents. Well, let me just spend 2 words of why in a mechanistic model we have a computational problems. Well, what we do basically is that we have initial conditions and parameter uncertainties of all possible forms and shape. So we don't know from the exact incubation time, transmissibility. We don't know how many cases, asymptomatic rate, and so on and so forth. There are also modeling assumptions, and there is the natural stochasticity of epidemic spreading. And so what you have to do is to explore that priors, and for each prior generate thousands of stochastic realization. Then you have a calibration stage in which you you throw away all the trajectory that somehow are not compatible with the evidence, and then you generate some results for importation probability or for the epidemic incidence and so on and so forth. Well, this is a large computational effort. Even for a single models with mechanistic models, this means really high performance computing, multiple parallel runs, and then high performance data analysis pipeline, because you are producing terabyte of data if you want to go, for instance, to the level of single counties or other jurisdiction. Then from there, we move into the forecasting and scenario modeling, in which you don't have just to do these once, but actually you have to do this on a routine basis for weeks and every few days. And so this is again add to the computational effort. And moreover, you at this point have to perhaps to sustain an effort for 2 years, also from the modeling standpoint, in the sense that you have to model a system for 2 years in order to get the right parameters for instance, the residual immunity in the populations. And this implies, you know, again, a huge amount of computing resources. Obviously, there are different targets, different way of approaching the problem of forecasting and scenario modeling. In one case, you can do the 1 or 2 or 3, 4 weeks ahead simulations. In another case, you have up to 3 months or 1 year ahead simulations, and all that introduce differences as well as different computing requirement to the computational work. Well, let me say, and I don't want to steal the thunder from Nick. I'm pretty sure he will talk a lot about that. That is really crucial to have multimodal forecast and DABs approach. I think really the modern computational epidemiology has to live in this space, in the fact that we have multi-teams, we do multi-model efforts and ensemble. Here, I've seen there are several of the people that have been, I would say, instrumental in having those hub approaches, Cecily Book, Katrina Shear, Rebecca Birching. I'm sure there are other people. Nick will talk about that, but this is really important. And here again, there is a problem of infrastructure, is a problem of computation, because you don't have just 1 or 2 teams, but you have, you know, dozens of teams in principle. Well, here are a few final considerations, really. Effective epidemiology for decision making, and these are points for later, perhaps. We need to have actionable results timely. We can't invent the wheel during the emergency. Computational pipelines have to be developed, and they cannot be changed. It's a major effort to change those pipelines, and they have implications in that. We need to create dependable long-time efforts. So you cannot just do forecasts for 3 weeks and then disappear. And so this is another important point where we need infrastructure and support. And then even more, you know, when we touch on multimodal and DAB ensemble, when you have dozens of individuals, hundreds of individuals involved in these efforts. Let me close just by thanking all the people that have contributed to the work that I've shown here. Really, many institutions, many colleagues. My contribution is nothing with respect to all of them and the collective brain that is behind the work. Thank you very much.
Thank you very much, Alex. Excellent talk. If it's okay with you, we'll reserve the questions.
Absolutely.
And yeah, so that everybody gets a chance. So next up is Rajesh Sundaresan. Rajesh is a professor in the electrical and communications engineering department and the dean of ECS at the Indian Institute of Sciences in Bangalore, India. I and Rajesh have both studied at the same institution for undergraduate. So, but we didn't know each other then. So COVID really got us together again after so many years. Rajesh actually he's a communication theory and theory expert, decision theory, communication theory, data-driven modeling. And Rajesh will tell you more, but his pivot to epidemiology was perhaps as a need of the hour from the standpoint of how the epidemic was unfolding in India. So Rajesh has been instrumental in supporting the national response efforts in India as well as a state response effort. And I'm hoping Rajesh will cover and talk about it and give a perspective from an international viewpoint and specifically India. So over to you, Rajesh. Thank you very much for joining.
Thank you. Are you able to hear me?
Yes.
Okay, thank you. I will speak about our experience supporting public health officials. I'll speak with respect to the state where we are located, which is Karnataka. I am in Bangalore. I'm at the Indian Institute of Science, and we've been helping the Karnataka Department of Health and Family Welfare Services. I'll speak about some of the experiences that we have had. So we have been building frameworks for evidence-based decision-making. There are many collaborators, Indian Statistical Institute, Indian Institute of Public Health, University of Virginia with Madhav's group, Google, Hitachi, and several other teams in IISc. I would like to thank all of them for the efforts, for the help that they have provided in this effort. Our effort actually began after the Imperial College report came about. It was published sometime in March of 2020. Some of the projections that report had were things that we couldn't believe. So we wanted to sort of build a tool ourselves and see to what extent those projections were true. So we went ahead immediately after that report came and built city scale models. Our city scale models were built for Bangalore, Mumbai. We also built for several other towns, but the ones that we communicated with the stakeholders were for Bangalore and Mumbai. There are roughly 12.4 million agents. When we communicated the result to the stakeholders, to the people that were in the Karnataka Disaster Management Authority, which was actually handling the pandemic at that stage, this was the kind of projections that we had provided. On the y-axis is the fatalities, and on the x-axis is the date. This was sometime during 2020, and we were in the wake of the lockdown, national lockdown that had been announced when we had very few cases, for example, in India. And when we showed these kinds of projections that once the lockdown, we can't be in lockdown forever. Once we get out of the lockdown, things may go back up, etc. Somehow it didn't fit with the narrative that was present at that particular time, and we had quite a bit of skepticism. The skepticism was very valid because there were things were quite complex. There were pre-lockdown closures, lockdown in late March 2020, and then mask mandates, guidelines for unlock, local lockdowns, testing policy changes, behavioral changes, and so on. So all of these were too complex to model. So how could the simulator take into account all of these things? Also, we had a large number of parameters, a city, one agent model, etc. So these were the kinds of questions that came up. Also, another point that was brought up repeatedly is, can you scale up to hundreds of districts and so on? There was quite a bit of skepticism and in trying to get these projections to be looked at. Ultimately, after discussion with the people, we did some scenario studies, A versus B kinds of studies, but we couldn't really convince the decision makers to take actions based on our studies. The lesson that we learned from this, so I'm going to highlight some of the lessons that I learned, is that the simpler it is, the better. The easier it is to explain, easier it is to understand, the greater the acceptability and also scalability. So we learned this the hard way. We were able to build at that time only for 2 cities. And if you are not able to scale up for several cities and on demand and be able to handle all the complexities to some extent, then we are going to have difficulty getting this accepted. And we might have to work on making all of these things acceptable now before the next pandemic hits us. So simpler the better was the first lesson that we learned after this particular exercise. Another question that we looked at was, we wanted to see how to help Mumbai get back to business. And one idea that came about was, in Mumbai, a lot of people travel together. They become sort of lifelong friends because they happen to travel in the same train day in and day out. And they got to know each other and became friends. So there was a sort of natural cohorting that was happening in Mumbai. And perhaps cohorting could be leveraged. Maybe we could engineer interactions in the coaches. And if we do this, then we could control the spread of the disease, and we could operate these trains in some limited fashion. So that was the idea. So maybe we can have cohorts come in and go out together. So together with Madhav and team, and also with Google, because Google was able to share some information about perhaps what kind of travels are happening and things like that. Although that data eventually turned out to be something that we couldn't use, because it wasn't clear to what extent we were seeing some trends which we couldn't explain. But what we actually did was explore this particular strategy, where we tried to not only engineer interactions, but these engineered interactions enabled targeted testing. So if we identified somebody was positive, all the others in the cohort could be tested. Not only that, it also enabled targeted isolation. And we wanted to sort of understand whether this could be a means by which we could open up trains in Mumbai. And these were the kind, again, our agent-based simulator helped us come up with understandings of the sort that structuring into cohorts helps, but just this structuring alone is not enough. You have to do this cohort isolation. So the network interactions, etc., are structured, but just that alone doesn't suffice. Testing and isolation is important. So our work, thanks to Google and its connects, we were able to get the Indian government's think tank, Niti Aayog, to lend their ears to us. And they arranged a meeting. The meeting was with several railways personnel from the Indian Railways, metro officials of a few cities. Also, All India Institute of Medical Sciences, AIIMS, there was a doctor who was handling the pandemic response. He was also there, and several other stakeholders. The kind of feedback that we got when we presented the result that I showed in the previous slide and several others was that these are good, but if we were to think of ground realities, how to implement it, it's going to be very difficult because compliance is something that will be very difficult to enforce, and also the tracking logistics, etc. So the feedback that we got from them was we look forward to seeing a version 2. And that kind of taught us another lesson that perhaps despite the niceness of the idea, it was a good idea. It had some merits to it, but it was not something that was implementable. So perhaps we should be focusing more on the implementable. And we did have a version 2, and the version 2 was somewhat more implementable, which was the idea that if you found amongst the travelers somebody that was positive, then you could gate in some random way or reduce the number of people that would be allowed to use the trains in that particular station and so on. So I think such ideas, which are sort of signals that you give to reduce the usage of the trains, etc., are more implementable ideas than perhaps the cohorting idea that we had. Cohorting might also be implementable in some other settings, but perhaps not in the trains. While we were discussing this, we actually interacted with the Karnataka State Disaster Management Authority, got talking to the individuals there. And the person was skeptical about our agent-based model, but it did get us to think together and discuss and identify ways and means by which we could open up the unlock strategies that we were discussing. So one thing that that person and I got to discuss was that perhaps if we can come up with a light touch control, lockdown is a one frame fits all. It's too heavy a hammer. Maybe if we can just give some sort of signal. So if you're able to operate your premises, for example, an insurance back office could operate like normal, whereas a regional transport office, which is like your Department of Motor Vehicles office, except that you probably increase the number of people there threefold or something like that, that perhaps ought not to be operating at full scale. So if we can somehow signal that this is the level at which you can operate for this level, for the current infection level, and if it increases, you say that the level of operation must go down. And if the pandemic infection level goes down, then you can raise this threshold. Then we can let individuals decide on what level of operation they can engage in. But in order to do this, individuals should know what is the level of operation that they can have, which will meet this infection threshold. So there is an information and an assessment problem. So towards this, we built this tool that if we can get each organization to enter all of these details and say that this is the mix with which they want to operate, what is the infection level that's likely to be, and does it Is it below the threshold or above the threshold? So we actually built this sort of survey and an evaluation form where each individual company would enter details here. And then there would be a self-assessment report for the kind of activity mix that they had planned. So these were personalized suggestions for that particular industry. And if it, for example, had a low score, then that entity could rearrange things in such a way that it could meet the threshold, and then they could operate at that level. This was, I think, used by about, this was in May 2020 or thereabouts, and about 150 companies actually used this. The lesson that we learned from it was a useful tool at that particular time when information about the pandemic was still slow to come. The lesson that we learned is that actually it helps if the decision maker has a stake in the idea, then there is greater adoption of this particular idea. And so this individual helped us take it to the state and advertise and get it to the companies in Bangalore to adopt this particular one. Also, there is a more important lesson, and that more important lesson is that if you enable decentralized decision making, light touch controls and decentralized decision making, there is greater buy-in and therefore possibly greater compliance. So this is an idea that we must explore, and I think it's an effective tool that perhaps is worth consideration. The next thing is related to sero surveys. This sort of came from the Karnataka Department of Health and Family Welfare Services. We were troubling them quite a bit with many of our epidemiological tools, A versus B comparisons. This is how you should open up and so on. And possibly just to shut us up, they said, oh, we are having this sero survey. We are looking for 2 statisticians. Why don't you come and help us with this sero survey? And my colleague from the Indian Statistical Institute and I welcomed this opportunity and interacted with them. And what we did here was conducted a statewide sero survey. Karnataka has about 70 million people. It's about 80% the size of the United Kingdom. So it's like a large European country by itself. So we helped conduct the sero survey in 290 sentinel sites, and identified ways and means by which we could do this, and demonstrated how the existing infrastructure could be leveraged. And the kind of findings that we could provide was this heterogeneity that we saw in the spread. This was sometime in September of 2020. That suggested that different districts had to act differently. And these were the kind of findings that we provided, that there are districts which have low infection fatality ratio and high cases to infection ratio, which means that cases are possibly being missed. And also certain other districts which have high infection fatality ratio, but that's also because it's low cases to infection ratio, and those districts are actually doing well. And learnings from there can be taken to the other districts. So these kind of insights, we then created these insights into these reports that we shared with various entities. And these were all automated. So it would be good if we can systematize these kinds of insights that people that actually work on the field can utilize and respond to. So the recommendations here, you can see, focus on clinical management in this particular district because it's seeing a higher number of deaths without a surge in cases. And also death audits should perhaps guide efficient clinical management and so on. So what good this sero survey data, apart from perhaps this sort of district-wise comparison, it also serves the purpose of maybe a friendly competition between one district and another, which says that, oh, this district has been doing well, maybe we should do as well as them, or also possibly learn from them. It enables such comparisons. Apart from that, it also provides very useful input to models, and we leverage this along with Madhav's team and also the Indian Statistical Institute team, and came up with this scalable model. We had started with a non-scalable model, but then this one we used an SCIR model, and we were able to scale it for the entire state of Karnataka and subsequently for India, where we kind of said that if you want to allocate scarcely available vaccinations, this is how you should do this. You should allocate it in proportion to the population for the best, for greatest effectiveness. And we had come up with a measure of effectiveness. But we could also provide insights that this was not happening. So if we were allocating vaccinations in proportion to the population, all districts would cluster here and then move rightward as time progressed because the dosage percentages would increase. But that was not happening. There were some districts, Bangalore here, for example, which was doing really well, and then some other districts which were not, possibly because they didn't have the capacity to absorb the vaccinations. But these were made, these were called out, and some action could be taken. So the lesson that we learned is that time-tested methods work. One doesn't have to, sentinel surveys, for example, one doesn't have to look for novel methodologies. Old methods can be utilized, and we can also leverage existing infrastructure and do these surveys rather quickly. The next point I want to make is, I think the next speaker will also speak about that, is we should learn from others. In India, we, despite the prevalence of models, somehow one model was selected rather than an ensemble of models being utilized, and learnings from the ensemble being taken into account. One model, so we followed a selection approach where we identified one model and relied too much on that. Instead, we would like to perhaps get a lot of modelers to supply their inputs here, and then look at what these modelers say, and then learn from the uncertainties, and in a sense leverage the modeling expertise in the country and let 1,000 flowers bloom instead of selecting and identifying one, which also failed in predicting the second wave, for example. So that's one learning. There was another learning that we also learned, which is a conversation that we had with Dr. Coetzee in South Africa, when she told us how they quickly identified that there was something new with the Omicron variant. It was because of a clinical surveillance that they had initiated. The moment the kind of symptoms that people were seeing were a little different, there was an alert system that was created. And based on this conversation, we went back to the stakeholders here, the decision makers, and told that this was something that South Africa had done, and perhaps you can think about doing such thing. And we were able to convince very recently, 21st of March, the commissioner, the state commissioner for Health and Family Welfare Services, to put in place a clinical surveillance mechanism. And this is the office order that essentially indicates that this is in place. So the lesson that we learned from here is that learn from others and also communicate these findings with the stakeholders. I'll summarize. The first lesson is simpler the better. It should be easy to understand, easy to explain, and it should also be scalable. The second lesson is focus on the implementable. This was the cohorts idea. The third lessons, there are actually two. First is somehow involve the decision maker, get the decision maker, listen to the decision maker and develop on the decision maker's ideas. But the more important lesson is, as far as the mechanism point of view is concerned, enable decentralized decision making, because then the individual decision makers are determining the mix with which they will operate, and they are likely to comply with the rules that have been put in place, which are light touch controls. Time-tested methods work, and then learn from others and communicate with the decision makers. Yeah, thank you.
Thanks so much, Rajesh. Absolutely nice talk. Very nice summary of all the work you folks have done. So again, we'll take questions after Nick's talk. So let's move on to our final speaker for this panel. It's a pleasure to welcome Nick Reich. Nick and his group at UMass Amherst are building some amazing systems to allow all of us to participate in the ensembling forecast effort. And I must say, Nick has been at the forefront of this effort that he's leading. I believe, Nick, you're going to talk about it a lot, so I will not discuss that in great detail, but I really want to applaud and acknowledge your contributions for getting all of us together in a form that we can contribute to the forecasting effort that US has put in place. So over to you, Nick.
Thanks so much for those kind words, Madhav. I'm putting some links into the chat so that you can sort of multitask and explore while I'm talking, sort of links relative to relevant to the Forecast Hub and sort of some of the related infrastructure pieces. So I'm going to structure this talk. I'm going to give a brief introduction to the COVID-19 forecast hub that that we set up in the US and that has been sort of exported for use in different settings around the globe. And then I'm going to sort of dive a little bit into some of the sort of nuts and bolts infrastructure that we use as a way of sort of jumpstarting a conversation about the kind of computational resources that are needed, both for the individual models, although I think the previous two speakers have sort of talked about that a bit already, but also sort of the infrastructure and computational infrastructure needed to support modeling hubs more generally. So I'll just acknowledge that my group's work on this has been supported by NIGMS and the US CDC. So here is the quick introduction to the forecast hub. So basically, for those of you who are not familiar with it, we in late March of 2020, so nearly exactly 2 years ago, we saw a need sort of in the modeling community to find a way to channel a lot of the voices that we knew were out there. We knew people were starting to think about generating models. There were some very prominent models that didn't always represent the sort of consensus view of epidemiological modelers. And we were trying to look for a way to build a system that could show the general public and decision makers the sort of the information that was coming out of a lot of these different models. And so we established the Forecast Hub. We launched it in the first week of April in 2020. And these were the goals that we laid out at the time, to sort of provide a system, build a system that could provide decision makers and the general public with reliable information in the short term about where the pandemic is headed. Also, because we can collect these data in a structured format to then assess reliability of forecasts in a historical sense once we observe these things, and we can gain insight into which models and which modeling approaches have a historic track record of doing well. And then the third piece is really that this whole effort has been founded on a sort of open science ethos of trying to help build a community and sort of bring people in, both people who are from very established and prominent modeling groups, but also sort of folks who have not been involved in this before, but were sort of looking for ways to put their skills to work during the pandemic. So here are just some numbers about what the Forecast Hub has achieved over the last 2 years. So basically every week for the last 104 weeks, the Forecast Hub has received forecasts from different teams, dozens of teams a week, of weekly incident cases, hospitalizations, and deaths in the United States due to COVID-19. We have built every week since the second week in April an ensemble forecast that combines these the probabilistic forecast that teams are submitting to us based on a quantile format, and we generate forecasts for 1 through 4 week ahead targets. We have collected a huge amount of data that is sort of far surpassed what we envisioned we ever might encounter for this. But basically, we've gotten data from at one point or another, 117 different models. We've received over 6,000 submissions of forecasts. And within those forecasts, if you think about the unique predictions that are being made for a given location at a given time for a given horizon in the future, there are over 90 million unique predictions, or close to 90 million unique predictions. So this is a big infrastructure that represents more than 500 million rows of data in a sort of tabular form. So there's like become sort of infrastructural issues that we didn't foresee early on. So this data, as other folks have mentioned, is shared with the CDC, and because of an existing relationship that we had with the CDC as a center of excellence of flu forecasting and our work with them on some of the flu forecasts earlier, we sort of helped channel the results from the system into the source of the short-term forecasts that are shown on the CDC website. So I want to just step back for a minute. That's sort of like there was this flurry of activity that really intensely over those first maybe 6 months of the pandemic, and it's gotten into sort of autopilot mode more or less now. But this effort has really built upon close to a decade of work in this area and sort of creating sort of these collaborative modeling enterprises. So this is, I think, a nice figure that was put together by Alex and his team that shows, here's our effort, the US COVID-19 Forecast Hub, and this work has sort of been adapted for use by some other groups in Europe, and also this in the US by the Scenario Modeling Hub. So sort of our infrastructure has been reused, but all of this work is founded on this, and really sort of would not have been possible without the vision of these folks at CDC and other places in the US federal government that have sort of set up these collaborative forecasting challenges starting back in 2013. And these have sort of laid the foundation, and there's been so much thought about data structures and how to solicit forecasts and how to organize them, that sort of helped pave the way. And we have really gained a lot, and we're able to start and sort of be ready to spin something up pretty quickly because of all this work that had gone on beforehand. So I think, as both the last speakers have mentioned, a key insight that has been seen in other settings, and some of the citations are listed here, but that we've seen again here in COVID, is that combining individual forecasts, it has provides a more consistent forecast than any single model. And here, I think you can sort of interpret consistency in a couple different ways. So one is that by relying on an ensemble of forecasts, you reduce dependency on a single model or team. And so that's sort of a pragmatic logistical concern. But there's also a sort of scientific reality that by incorporating these multiple perspectives and multiple uncertainties and different model structures, you incorporate these different perspectives and you end up on the whole with a more consistently accurate forecast as well. So here's just like a picture of a forecast. This is a little bit of a cherry-picked picture where the models were doing fairly well. The models are not always as consistently accurate, but here is a set of forecasts based on the data in black here. This is, I think, hospitalizations at the national level. Here's the gray data, is data that we have sort of seen as of mid-fall of this last year. And then here's sort of the picture. You take all these forecasts and you sort of create, those are all the individual forecasts, and you sort of synthesize them into a single cone of uncertainty and a single ensemble forecast. Just like one comment on one of the scientific things that we've seen here is that I just want to make a comment about the accuracy of these forecasts in an aggregate kind of way. So this is a picture showing 95% prediction interval coverage. So these models create prediction intervals. One of the types of intervals they create is a 95% prediction interval. These intervals should cover the eventually observed data 95% of the time. What you're seeing here is on the x-axis is the horizon. So how far into the future models are looking. Our hospitalization forecasts, for reasons that I'm not going to go into right now, are made at the daily level, and new deaths and cases are made at the weekly level. So I think there are a couple interesting things to take away from this figure. One is that all models are a little overconfident. That is, their prediction intervals have tended to be too narrow and not quite cover the truth as much as they should be. That coverage declines, so it gets worse the further you look into the future. That's not a surprising finding. And then the other thing is that the coverage is quite different for these different targets. So hospitalizations start quite good a few days out, but deaths are fairly consistently between 85 and 90%. Hospitalizations start around 95 and decline down to a little bit less than 80, and cases drop off very quickly, starting around 90% and dropping down. This is coverage for the ensemble forecast. The individual models vary quite a bit. But this, I think, these overarching messages, I think, are true for quite a number of models and approaches. So I want to just spend a few brief minutes talking about what I see as the role of computing and sort of the infrastructural components of the Forecast Hub, and maybe a little bit broadly the other hubs, although I'm going to focus a little bit on our individual experience. So I sort of break this up into a couple different ways. We can think about the needs of individual component models, that are the individual teams that are generating a forecast. And I think what we've seen, we don't get a glimpse into very many of these. We run some individual models from my group at UMass. We run some, so we have a little bit of a window into that. We know a little bit about what other teams do, but obviously we don't have the direct experience of the other teams. But I think what we can say safely is that individual component models have very different computational needs. I think the model that Alex described, I think, is on the at one end of the spectrum in terms of being quite complex, quite computationally complex. There are other models that are very, sort of simple statistical time series models that can run in, minutes to less than an hour. And so I think it's important to see that there's this like wide spectrum of computational needs and time that these different short-term forecast models need. From the hub perspective, there are a couple different pieces, and I'll talk about these in a little bit, or I'll talk about these individually briefly. One is thinking about sort of this needing a central repository where data and code can be stored, and then having local or virtual machines that can be used to run some of our key outputs, like these sort of baseline models that we at the hub generate, and the Ensemble models, that some of which are, we have a couple different ensembles that we run. Some are pretty quick, some take longer. And then also sort of the infrastructure of serving the sort of weekly products that we generate, of visualizations and weekly reports, this sort of thing. So just a couple notes about each of these pieces. I made this comment already about how long the models take. We surveyed the groups at one point, maybe 6 months ago, and teams reported spending a wide range of time on their models every week. So some teams, basically, it's like entirely automated. They're very little to no checking. Some groups are spending over 40 hours a week of person time, like running, checking, validating, updating their models. As an example workflow for one of the models that we have run out of our group at UMass is that we have a model that runs on a cluster on Sunday night. There's a human in the loop who inspects the forecasts, possibly makes adjustment if there are some weird data issues that are throwing the model off, reruns selected forecasts for specific locations, and then you submit the forecast by midday Monday. So that, I think, is a fairly typical workflow for one of the models. Thinking a little bit more from the hub perspective, so one of the pieces that the hub needs is some kind of a central repository or database. So the three pieces that I see here are having a structured data format for model output. This is something that, thanks to our existing collaboration prior to COVID with CDC, we've put a lot of time into thinking about, and this forecast archive that we've built called Zoltar, that you can go visit online and sort of see. This is a sort of browsable SQL database that is sort of a mirror of our central GitHub repository, which is where people submit things to. There's a whole set of validation code that can sort of enforce the data format. So we use Python in our packages. And then, of course, we have this sort of all the submission is done through GitHub. So people submit their forecast to GitHub. And this is just a screenshot showing, a set of forecasts. These like we use continuous integration so that tags are added to forecasts based on the content of the pull requests. There's an auto merge label that can be added if a pull request is really simple and valid. It just gets pushed right in. So this has taken quite a long time to set up and automate, but it's working pretty smoothly now. And we've actually taken this infrastructure and have used it for a new flu forecasting challenge that the CDC has started in January of this year. So this is just like a very loose picture of sort of how we can think about the infrastructure that we need to run the baseline and Ensemble models. Sort of, you can think of there's like some GitHub repositories, some public code where we have both raw data and model codes. Maybe it's APIs for data, and we have some model code. We set up a virtual machine to sort of be a computational space where these models can run. This actually has taken one of our lead developers quite a lot of time to set up carefully. So that it's not dependent, because there are all these little hidden dependencies that you sort of are set up on your computer because you don't really know it, but to do it from scratch really takes quite a long time. And so but now we have it set up so that basically every week at set times, certain jobs are run using data that are available at that time. And then the Ensemble, the baseline forecast, the Ensemble forecasts are pushed then back up to to our GitHub repository as potential forecast submissions. So then another piece here, so those three bubbles are now sort of on the left here. Once the Ensemble forecast is updated for a week, so this is typically sort of early Tuesday, late Monday night, Tuesday morning, then we use the same virtual machine to pull those model outputs out and then generate summary reports from that data. So we have an online visualization that's updated, some weekly reports that wrap some natural language around the outputs, and those are also all automatically generated at a slightly later time. Here's like the full rat's nest of the infrastructure that we've put together. This is very COVID hub specific. I think if we were to sort of think about the general pieces of this, we could sort of pull out some more general pieces, but you can see there's sort of these mirrored repositories, one that lives in GitHub and a central database, a lot of different software packages shown in blue here. So code that are doing different pieces of things, data from the cloud, a lot of forecasts and metadata that are coming in about forecasts, but getting passed through a validations layer first, and so on. So I'd be happy to talk more about different pieces of this that are of interest to folks. So thanks for your attention. I just want to acknowledge that, like, you know, I'm here representing a very large community of modelers. I mean, we have these papers that have over 300 authors on them now because we're trying to make it clear that, like, there's just a huge amount of person time and effort that goes into all of this. And in particular, I want to acknowledge the co-director of the US COVID-19 Forecast Hub, Evan Ray, without whom much of this would just not have been possible, and also the CDC collaborators, so I think some of whom are on the call. So thanks very much.
Thank you so much, Nick. It was absolutely brilliant. And we have Matt and Michael Johansson also on the call. So, you know, I would like to acknowledge their support in building out this hub, as well as the CNU team that you called out. So I think let's move on to the question answer session. Rajesh, I hope you're still there. Good. You got worried for 30 seconds. So let's see if folks have posted any questions. I can start, otherwise I have a few questions, and maybe that will get us going. Folks should start at the posting, or you can raise your hands if you want. We don't have that big a group that we cannot accommodate a direct set of questions. So do raise your hands, and we will try and do it in that order. So maybe let me start by asking a couple of related questions to all three of the panelists, and I think hopefully we'll get a different perspective on it from their experience. But the first, two interrelated questions. One is how hard or challenging was it to get good data during all this effort? I mean, we of course have faced that, and I'm sure Alex and Rajesh and Nick have faced it, but I want to hear their perspective. And then second part that all of you again alluded to a little bit is, did you see any challenges in terms of accessibility to computing? John Towns is here. He has been a real important person in terms of getting our requests through for computing needs. Did you see that in your work, or what? That was not such an important issue? So I'll open it up. Maybe anybody can start, but let's go around and hear what you folks will think.
Well, I can start. The problem with the data, you say, if there was problems with the data, I would say there are problems with the data. Unfortunately, it's a constant thing. I think with Nick and all the CDC people, the modeling teams, we have this call every morning, every Monday, or actually Tuesday, and we comment the forecast, etc. And it's always a struggle and fight against data which are problematic. There is no way that we can escape this, I believe. I think, for instance, when in many respects, also the performance, Nick was showing how much the models falls in the 95% confidence interval. In some cases, I think all the models underestimate the noise, also because part of the noise of the data are completely due to reasons which have nothing to do with any epidemiological explanation, or even, so there are random events, the states that do not report 1 week, then you cannot backfill the data. And so, things are very, very noisy. And then at the very early stage, it's a major problem, that really, even deciding the format, whatever. I believe this is one big issue. The second point on data is that we were able during the pandemic to create a data pipeline, not just for the cases, deaths, etc., but also for all the behavioral data that we need in models, like mobility and so on and so forth. And I'm really worried that it will be very hard to sustain those efforts. Even the data provider are not so keen. You know, in the early days of the pandemic, everybody wanted to contribute, everybody wanted to give a whole hands on deck support, etc. Now you talk with those providers and they say, well, but we cannot keep engineers doing this work with you, and so on and so forth. Finally, on the computational pipeline, as Nick mentioned, it's true, not all the models have the same need. For instance, in my case, we need of a very heavy computational pipeline. I think also at Madhav, for yourself, Virginia, as a lot. And one thing is that perhaps people do not realize that when you have designed a pipeline on a system, for instance, we use Google Cloud, moving that pipeline is extremely time consuming, it's almost impossible. So for instance, during the pandemic, I had a lot of offers from people telling me, well, we can give you, you can use these other machines, these other clusters. It's not like that. It's not that you have to run a job simply like that. And so I think this is again where we need preparations. We need to have teams that have infrastructure. If there is a commonly provided infrastructure, for instance, Nick was saying that we are really indebted and grateful to the Center for Disease Control, for the NIH. They have provided resources to us, etc. But I think we have to systematize things and say, okay, now we build platform on these systems, you will get funding for doing that, and the things will be there. And we can count on those, because then if we have to move during a pandemic or we have to scale up on another system, etc., that will be, it's very, very hard. And so I think there must be a long-term vision. Again, for weather forecast, it has been adopted. There are some supercomputers that just do that. So why can't we have something like that? We should think about it, and not just to have, supercomputing borrowing us or lending us, or we can borrow here and there, etc. So, thank you.
Excellent. Very good ideas, Alex. Rajesh or Nick, you want to add to this, please?
I'll go next. I'll highlight some of the issues that we faced. The first one was with respect to the agent-based model that we tried to develop. I think a lot of data was taken from the census portals, but we found that the census portal data had quite a bit of unstructured, it was a machine-readable format, but the formats were somewhat different in different files and so on. So I think it was a big factor in us not being able to scale to various cities. Other factors aside. So I think in order to make the tool scalable, we need to have these in a structured fashion. It's a problem that is easy to solve, but we'll have to do it perhaps now and be prepared to be able to scale up when the situation arises next. So that was one. The second one is actually related to structured data coming from the different states. This was an unfortunate situation where each state put out its own format, some in PDF files, some in some as almost nobody has Excel files or CSV files, some as images, and so on. So we really had to build a text reading pipeline, which perhaps was unnecessary if a certain standardization had been put in place. And we were largely relying on crowdsourced methodologies to be able to gather this data. Some of you may have, for modeling Indian scenarios, you might have used data from this hub called COVID-19india.org. That was largely volunteer run. And they were basically pulling data from the reports of various states' bulletins, which were all in different formats, which we could have perhaps standardized. That didn't happen, and despite our requests, somehow it still is a difficult thing to get the states to get into action towards a more standardized format. The third thing is, I think because it was not standardized, there was quite a bit of testing variation, etc., across the various districts. But there would be cases which are district-wise, but testing would be statewide. And so we wouldn't know about the variability in the testing in the various districts to be able to fine-tune our models. So which affected the predictability of the prediction performance of the model. So I think some standardization here would have also helped. I think these are things that perhaps got hardened right in the beginning, and then they were difficult to change. But when things start afresh, one needs to give a lot of thought to it and structure it. And I think the CDC effort for Flu Watch enabled perhaps the kind of standardization for the forecast hub. Something like that is perhaps necessary. Learnings now we should take forward and ensure that the next time such a thing happens, things are standardized. On the computation side, I think we didn't face as much difficulty because I think there were heavy compute items right in the beginning, but we had the supercomputers at our institute. And then subsequently we moved to more scalable ones. So I don't have anything to add at this stage on the computation requirements.
Thanks, Rajesh. Very useful comments. Nick, you want to add to this?
Yeah, I'll add just a couple quick comments. So I just want to first say that there still is so far to go, right? There's so much more to do to make data accessible. But I also want to point out that we've come a long way. Like 2 years ago, the latest flu data that you could have was aggregated at a state or regional level, and it was a week old at best, sometimes a week and a half. And now we have COVID hospitalization and flu hospitalization data that's 1 day old, updated every day, maybe not on weekends, at the facility level. So this is like an improvement, an incremental improvement for public health, the sort of key data streams that we're looking at. And that's, so I just want to point out that to me has been like an improvement over prior data availability. I want to just sort of mention that I think what the group at Carnegie Mellon has done, building out their Epidata API system, which if folks aren't familiar with this, you should go check it out. It's I think a really great prototype for what a sort of bigger system that contains a lot of data like this should be. It's a formal API with standard data formats, thinking about different versions of data, which is really important for retrieving epidemiological surveillance data, being able to go back and say what data was available at a particular moment in time, because things are always updated. I wonder, I'd be curious to hear other people on this. I think Alex's comment about like, we want to build something that's like the weather systems and the data that are available to weather. And I think that's 100% true. And I also wonder how the challenges are different for this field, because the data that is needed comes from such a diverse array of sources. We need data from public health surveillance systems. We also could use some climate data. We could use mobility data. And it's like such a hard problem to think about getting these data from different places into one standardized format. I think it's a lot of human time needed to take the data that may exist into that format.
Yeah, that was actually, you and Alex and Rajesh really make some very important points. I just want to say, John agrees with you, Nick. He thinks you're spot on in the comments box, and he also thinks it's more than incremental, advance that we have all made from moving from week to a day, which I think it's true. We have 3 questions. Anil, if you want to go ahead and ask your question, please do that. Lakshmi, then you can ask, and then Srini, the three folks lined up. So.
Sure, yeah. So, thanks for the great talks. I really enjoyed them. So, this is about the computational models. So, can you say a little bit about the calibration and some of it? I guess we've already touched, and it's related to the data, but specifically, what kinds of challenges you faced and what kinds of new questions that poses for future.
I could try to. Oh, sorry, Rajesh. Go ahead.
Yeah. No, I was about to suggest somebody else. Yeah, go ahead, Nick, and then I'll come.
Okay, I was going to say, so I think what, Alex's point earlier is a good one, that there's a lot of ways in which these ground truth data sources are really unstable and are very hard for epidemiological models to predict, because in some ways there's a way in which they're really not a signal of a pure epi signal. That said, I think there are very systematic trends that you see in performance. So for example, we're trying to predict a non-stationary time series, things that go from sort of bumbling along really relatively stable to just exponential growth for a month or two, and then right back down. I mean, you look at Omicron in so many states in the US, and it was just incredibly steep in both up and down directions. And consistently, basically, when that happens, if you go to the visualization and just sort of click around through some of those times, the models systematically underpredict and have systematic underconfidence on the upswings, and similarly coming down. Some models are learning. I think the calibration is getting better as we see more of these shapes of these different outbreaks. But I think, at least initially, fundamentally, it's a little bit of a problem of we've never really seen these kinds of things before. And it's hard to be calibrated in that kind of a regime when things are changing so quickly.
Maybe I'll go next. I think calibration was one of the biggest challenges, particularly with our agent-based model. And even while it wasn't as big a challenge with the other mean field models, we still had some challenges there. The way we, at least in the mean field model, we were able to get over some of the issues was to look at invariances and also learnings from perhaps other places. So for example, I'll give one example. If you look at Delta versus Omicron at South Africa, there are many variants in South Africa and India, so you can't just directly apply those things. But perhaps the Delta advantage, also Omicron advantage over Delta, is some invariant because it is perhaps because of biological factors, which could be applied to other places. So I think we were looking for invariances of this sort to overcome the challenges. So the Omicron to Delta multiplication factor, even though South African, the social network in South Africa is very different from that in India, perhaps the biological factors are the same, and we could apply that. Of course, we had to take into account the different vaccination statuses and so on. So that brought in some new challenges. But I think look for invariances like these, and that might to some extent alleviate some of the problems. I think for these we'll have to discuss with the biologists and also with the other epidemiologists. So that's one thought.
Thanks, Rajesh. Alex, you want to add to this, please? Okay. Maybe we can.
Yeah.
Go ahead. Yeah, please.
I was just saying it's all true, and the calibration problem is related to the ground data. Just really in 1 second, is also very different if you calibrate, for instance, for a scenario, or if you calibrate for the forecast. Obviously, for forecast, you need a very strong alignment in the next 2-3 weeks. For scenarios, you may be more how to say relaxed on the last 4 or 5 data points, and you want to capture what is happening later on. And so you are less dependent on the noise of the signal in a way, but really look more at the overall trajectory of the epidemic. So I think also it needs to be, this is a question that has to be framed with respect to what you want to answer with the model.
It's great. Lakshmi, if I could just take one opportunity to invite Lauren Gardner to say what she thinks about data, because then we are moving into the modeling set of questions. Her group has done a tremendous job in building what I think is the most used website in terms of getting data, and was done very early on. Lauren, I don't know whether you're still online, but if you want to take the floor and say a little bit about your your experience in managing all the variety of data that you have collected and shared.
Yeah, hi, I am here. I didn't have any particular thing prepared for this, and it's a bit of a can of worms. So,
Okay.
yeah, I'm not.
That's okay.
I think that the topics that have been discussed are spot on, and it's kind of like Nick said. I think we've made a lot of progress, but it's very much an ongoing effort to try to figure out how to make the data that we're collecting be as representative of the actual epidemiology that we're observing. And I think, kind of like Alex was referencing, that's been the biggest issue that we have, connecting the data to the modeling, and it's impossible to properly understand, build, and validate these models without having that connection to good data. And I think that from our perspective, it's a lot of direct, time-consuming communications with all of the different jurisdictions that are providing data, trying to push for this better open standardization so that the data can be, even if it's incomplete, be incomplete in a similar fashion, I guess, in terms of both what's reported, how things are defined, and the frequencies. And I would rather have weekly data that was closer to the ground truth everywhere than noisy daily data where you couldn't trust it. And so I think we just, moving forward, want to think about what's a realistic format that it can be provided in. And I think that the other thing that's really unfortunate is, of all the work that we've done, I'm afraid a lot of it won't transfer moving forward because of this lack of standardization and how the data is provided. We've got hundreds of custom built scrapers collecting this. And, you know, if it's not COVID data, then I'm not sure it's, you know, that we're going to be able to just move the infrastructure in parallel to something else, which is a huge loss. And I think something that shouldn't, you know, need to be that way. So yeah, it's a can of worms. I think if there's any specific question, I would be happy to try to answer it. But I think everyone on this call that has been using the data is probably as keenly aware of the issues that we have with it and the challenges as we are collecting it. So
yeah, thanks. That was very useful. I mean, you've spent so much time doing this, and I want to make sure your opinions are heard.
Yeah, thank you.
Thanks. Yeah, Lakshmi, over to you. Sorry.
Thank you to the speakers. Excellent talks. I really enjoyed them. I had a quick question. You know, Rajesh observed one of his lessons was that simpler models are better and so on. And from the talks, I see that, you know, in the hub and so on, there are many models used, and we were able to have general comments about the complexity and so on. And the question is, did you observe that did the complex models do better than simpler models, at par or worse, or, you know, was there a trend? Because I think we looked at we looked at other aspects of it, but we were probably, I don't think we saw the accuracy of the models based on the complexity of it. I know it's a subjective question, but in general, what is the take? What do the panelists think about that?
Maybe I'll go first here. We did have a lot of difficulty with the agent-based model because we weren't comfortable with the many parameters that were there, and whether we would be able to track, at least to some extent, the variations in testing. And so there was a little bit of sensitivity to the parameters. And that made us a little uncomfortable using those simulation projections. Now, I think that's probably like weather prediction during its initial phases. It just says that there is a lot more work to do to quantify uncertainty and so on. So we shouldn't give up. I think there is activity that needs to be done, and there's some promise there. But at the same, so simplicity helps, but at the same time, extreme simplicity also leads to certain kinds of projections which are suspect. For example, I will highlight some projections which were related to the possibility of when the next wave would come in India, the fourth wave. And it was based on, for example, just looking at periodicity of the waves at previous locations did not take into account the fact that vaccinations have gone some distance, and any new variant that might come in may have to overcome hybrid immunity from perhaps Omicron infection as well as vaccination. So I think if one takes an extremely simplistic view, there are also these issues that have to be explained to some extent. And therefore, I think the mechanistic models have an advantage here than perhaps these time series based models or just feature based models of this sort. We saw 6 months back, every 6 months something seems to be coming, and so the next one is going to hit us in another 6 months. So I think that's the remark that I would make. I think, can you explain what you have done in a convincing way? And if you can do that, then that would be good. You could convince with a simple model, but I think that explainability is an important aspect.
Thanks, Rajesh. Alex, Nick?
I would rephrase the question in a different way, and I would say, what level of complexity is adequate with respect to the question that you're asking? For the forecast up to 4 weeks, it's very likely that, for instance, simple model able to capture the dynamics of the trajectory might work better than models that need more parameters exploration, etc., and more data. At the same time, the level of complexity that you have to introduce to do scenario forecast, scenario analysis, in which you have to consider vaccine uptake, introduction of new variants, etc., requires a certain level of complexity. And we have seen that in action, because the forecasting hub, indeed, there was, Nick mentioned, about more than 100 models, and I think at least probably 40 constantly submitting in a way. For the scenario modeling hub, Kat, and you can tell me, probably we are about 12, a dozen or something like that, 15. So you see that because you requires to have models that have more complexity built into. If you want to do things like work we do at the early stage of a pandemic, when we talk about estimating introductions, etc., it's very difficult to work with time series analysis. You need to introduce the complexity of the human mobility process, travel data, and so on and so forth. So it really depends on the questions that you are asking.
Thanks, Alex. Nick, you want to go next?
Sure. I think Alex's comments summarize a lot of what I was going to say really nicely. We've looked a little bit at this question. I think one additional piece that I want to add is that it's actually fairly hard to draw a clear line between what makes a model simple and complex. Like even models that are on the face of them that seem fairly simple can be complex in subtle ways. And so that's, I think, another challenge that we've faced in trying to answer this question and think about how to classify questions as simple or complex or statistical versus mechanistic. I think the lines are not always very clear. And I think in a sort of maybe a most direct answer to your question is that we have seen models have high accuracy that are of all different stripes. And it varies, and there's just been a lot of variation in individual model performance, which makes it hard to draw any sort of consistent conclusions about things.
Thanks, Nick. So we have about 5 minutes, maybe, and we have 2 questions. Srini has a set of questions. Rebecca, you get the last word with the last question. I want to make sure your question is heard and answered. So Srini, you want to go next, and then we'll end with Rebecca's question.
Sure, Madhav. First of all, thanks to all the speakers. I think we also have to thank Omicron for giving this small lull where people could reflect on and give a lot of insights into the workflows. So the questions that I had, I think Nick had already answered one of the questions. I wanted to understand, how do you reconcile this, the scalable aspect of computing and the rate limiting but also necessary step of human in the loop, either for investigating the plot, just looking at outliers, but or like actually thinking and trying to explain it to the policymaker. And on a related note, since all of you work with policymakers, like how do you negotiate this trade-off between like responsiveness and reliability? Like you can give an answer in 1 day or 1 week, and there's a lead time that you need for giving robust answers. But so how do you handle that?
Alex, yes, since you're smiling, I'll let you go first. That's a hard question. I know she threw a curveball at you all. So.
I take the last one. Is that generally there is no negotiation. We have we are given a deadline, and generally is always 24 hours. No, so it's no. I think there is. Yeah, you are trying always to do your best, but it's a different is what I was mentioning at the beginning, is this wartime mode that is completely different. At certain point you have to produce answers. You want to, I think my trade-off is okay, it's what is the confidence level that I can have, and if you are honest in the way you communicate the confidence level, that's I hope this will be, how to say, will be useful. And if I say these are the results, but look, the confidence interval is like that, or even if it's not the confidence interval is like that, but I can say, look, there is a long list of source of uncertainty that are not included and should be considered. That is honest communication that should be done. And this is the way I see it. This is also why I go to the human in the loop, because I think at the end it's impossible not to have the human in the loop. First for the data assessment, then for the simulation and assessment, and then for the communication. This has to be done and has to be there. So just pushing a button, get some numbers can be done, but I think it's very, very dangerous. And the human in the loop is crucial. I think also weather forecasts taught this lesson to us. The humans are always in the loop. The meteorologists are there, even when they communicate things, they revise things. When they do the small scale forecasts, they use their own experience on the field to modify it and so I think it's really important. And the other thing is also related to before, in a sense, the human is important because it's true that the model can be simple or complex, but at the end, when you talk with, you want to have policy making, they have to be interpretable. There will be always a question why you get this result, and you have to be able to understand that. If you have something, a pipeline that produces some numbers, but you cannot say why it's producing that number, I think the usefulness of that approach is very limited. Perhaps, yeah, for a couple, let's imagine we have the perfect neural network that provides the 1 week forecast with perfection, it would be okay, but then it won't answer tons of questions that generally we are asked by the policymakers that requires the human in the loop and open the hood of the model, etc.
Thanks, Alex. Rajesh, you want to quickly chime in, and then we'll let Rebecca ask the last question.
Yeah, so I can relate to what Alex said. I think it's deadline driven, and you can only do so much before the deadline. And so communicate the uncertainty. I think that's what we also did. Be honest about all the uncertainties, and then lay all the cards on the table.
Yeah. Thanks. And Nick, you already answered, so I'll maybe in the interest of time, I'll let Rebecca ask her question. I think it's important to hear her. Go ahead, Rebecca.
So I mostly just had a comment about immune histories and how I think that that will be a next huge source of complexity for moving forward, thinking about both COVID and other pathogens like influenza. But it relates a lot to this session that's been had about what your question is and sort of how far back are you looking and what are you trying to project. So not as much of a question, but I would like to really thank all of the speakers, and this has been a hugely interesting and helpful discussion.
Thank you so much, Rebecca. It's 12:32, so I would like to close the session by first thanking the three speakers. Absolutely brilliant talks with a very diverse perspective and very thoughtful answers that you all gave along with the questions that were asked. So I think this information will be very valuable, not just to folks who listen. A lot of folks have said they will listen to the recorded version. That's one of the advantages of Zoom style meeting, but also to NSF as it prepares, plans for what research people need to do. So thank you very much again. Just to remind you all that we have a session in the afternoon and then 2 sessions at the same time tomorrow, one in the morning and in the afternoon. And I invite you all to join. I hope this is useful for all of you, and I look forward to further discussion. Thank you very, very much again, Alex, Nick, and Rajesh. Brilliant work.